Dr. Greeshma Baby, specialist in pediatric neurology, KIMS Health, Trivandrum. Whether there is cure for epilepsy, that is always a question. Yes, cure in epilepsy is equal to seizure freedom. So, whenever a child coming to our OPD, we give anti-seizure medications. So, first episode of seizure, we never start anti-seizure medication. We will do EEG, we will do the MRI brain, and if it is showing abnormality, we will start with correct choice of anti-seizure medication. There are two types of seizures. It can be focal seizures and it can be generalized seizures. If it is focal seizure, that means it is coming from one part of the brain, then there are few anti-seizure medications for focal seizures. There are different anti-seizure medication for generalized seizures. So, based on the etiology and based on the seizure type and age of the child, we will start anti-seizure medication. We will tell patients that they have to strictly comply to the medication. That is an important thing. So, like 8 a.m., they have to give in the morning, 8 p.m., they have to give in the morning. If it is vacation, if they doesn't have school, so correct to the timing, they will lead to seizure freedom. So, if a child is seizure free with the medication, only thing is sleep. They have to be very punctual. Sleep hygiene is an important thing in seizure control. They can attend normal day-to-day activities. They can go to school. They can go to sports. Everything will be okay for them. Now, what is drug-resistant seizures? If a patient is not getting seizure freedom with two anti-seizure medications of correct choice and correct dose, then it is called drug-resistant epilepsy. In drug-resistant epilepsy, we have a lot of options like surgery. Epilepsy surgeries are doing in our unit also. If it is coming from a small part of the brain, like there are different causes, like it can be a small tumor, or if it is a cortical dysplasia, always we will refer to the epileptologist, we will do a prolonged EEG, and we will mark the area, and there are surgery options. Then after surgery, they will be have seizure freedom. Then another thing is about vagal nerve stimulation. If the patient is not benefiting, we all cannot go for epilepsy surgery. Then that is called vagus nerve stimulation. It is a battery operated one. We will keep to the left side of the chest, vagal nerve thing will be connected, and whenever seizure occurs, before that, the alarms will come and there will be seizure reduction in number of seizures, not 100% cure in case of vagal nerve stimulation. Another thing is about ketogenic diet. So, ketogenic diet, there are some seizures, the indication for ketogenic diet. So, all will be knowing about the ketogenic diet where carbohydrate will be low and we will give more of fat and protein, like 1:3 ratio. So, whenever a child need energy, so instead of glucose, the fat will be burning, and the byproduct of fat is ketone. So ketosis will be maintained, and ketone have the capacity to reduce seizures. So we have seen that in drug-resistant epilepsy, we can start ketogenic diet, and that helps in reduction of seizures, but you have to consult your dietitian and doctor. There are few blood tests we have to do weekly, and daily we have to see urine ketones, and you have to be in constant follow. Another question is whether a seizure child or an epilepsy patient can lead a normal life. The answer is yes. They can, like a normal kid, they can go to school, they can participate in sports, they can do all activities. Only one important thing is sleep hygiene, a good sleep hygiene. Otherwise, there are recurrence of seizures if they are getting a poor sleep. So always an epilepsy patient can marry, they can have kids. So only thing is if they are on anti-seizure medication, if they are pregnant or like that, we have to plan it and we have to change the anti-seizure medications which are good for the patient and the baby. Thank you.